participating to select a language to listen to the interpreter section. To do this, you need to find the interpreter settings and select English or Spanish, just like you see on the screen. That little globe is what you click on. Please select a language. If you can understand both languages, still pick a language, because this will ensure your audio connection remains stable. The webinar will be conducted in both English and Spanish. Every participant, not only Spanish speakers, will need to select their preferred language. I will be speaking in English, but board member Schmerelson will sometimes be speaking and asking questions in Spanish. If you do not select a language, you will not be able to understand him if you need Spanish. Instructions on how to do that will be projected on the screen. We want to thank all of the 1,000 participants that have registered and sent us their questions. The questions will be answered after the presentations during the question and answer time. We have a lot of questions, and our presenters will do the best they can to answer as many as we can in the time possible. I want to just one more time, for those of you still signing on, to remind you how you can get to Spanish and to English. So first, if you require ASL, find the video that says ASL interpreter, and then pin that video by hovering over the video and selecting pin video from the drop-down menu. On the other hand, if you're looking for how to stay in either English or Spanish, it's important to pick a language, even if you're bilingual. To do this, find the interpreter setting, which is that globe that says interpretation underneath it. And when you find out and click it, if you want to hear the meeting in Spanish, you click on Spanish. If you want to hear the meeting in English, you click on English. Thank you all. Thank you so very much. I know you've spent a long day already at work and with your families, but thank you for joining us. We're going to try and do the best we can to give you the most up-to-date information. And now, without further ado, Board Member Schmerelson will take over.
Thank you very much, Jackie. Déjeme decir otra vez en español, para traducción en español. Toque el globo que dice español abajo. El globo que dice.
Say it in Spanish right now.
Aren't I saying it in Spanish? Not now. Okay. Okay, we're good. Okay, Jackie, I will continue. Let's see. I believe, Jackie, you're going to talk about where we were in March first, and then I'll go on to introducing our speakers. Huh?
All right, thank you.
No, I take that back, Jackie. I was on the wrong.
I think you're next.
You are so right. I am next. Thank you so much. Let's see. So before I introduce our speakers, I would like to know who is participating today. So you'll see on the screen, 605. Wait a minute. Oh, Jackie, I'm so sorry. I am so sorry. I'm first time working with Jackie Goldberg, so I'm a little nervous. So I am so sorry. We're at the 6:05 period, and let me just say, thank you, Ms. Goldberg. Now to get started, this is Scott Schmerelson, LAUSD board member representing Board District 3. Board District 3 is in the Northwest and Central San Fernando Valley, and also part of the East San Fernando Valley. I want you to know that I proudly represent 110 schools in 20 San Fernando Valley communities. And I am so honored to be hosting this webinar with my colleague and friend, Board Vice President Jackie Goldberg. So I know that many of our LAUSD parents are continuing to support their children through virtual classrooms and online teaching. And with continuous challenges due to COVID-19, we are continuing to support learning through virtual classrooms and online teaching. Okay, so what do we have to do? Well, we have to continue to juggle families between their work, their health, and their personal responsibilities. I know it's hard. And many of you have reached out to my office with questions and with concerns about the measures and protocols that will be guiding us when we decide that it is safe for our children and employees to begin returning to campus. So I want to stress to you that all of our LAUSD family are committed to making sure our schools are safe for students, staff, and families. We are committed to deciding carefully, very carefully, when to reopen. And we do not want to rush to reopen and then have to close all over again. So we don't want to cause any unnecessary harm, and we are committed to being good stewards of our resources. So the purpose of today's webinar is to provide clarity on the work that is currently being done by the district properly to prepare for a safe return. So before we continue, Ms. Goldberg, can you briefly introduce yourself? Of course, everybody knows you, but would you please introduce yourself so that our audience knows what areas you represent, and would you provide us with some brief remarks? And I want to let you know that I will be switching to speaking in Spanish after this, and I'll return to English at the end of the webinar. So go ahead, Jackie. Thank you.
Well, thank you very much, Mr. Schmerelson. My name is Jackie Goldberg, and I represent Board District 5. Board District 5 actually has the largest numbers of students in LA Unified Schools of any of the 7 board districts. I want you to know how proud I am to represent this area. It includes the northeast part of the city of Los Angeles, from Eagle Rock south down to Echo Park, and west to Hollywood, and east into El Sereno and places like that. And then we come down southeast, where I now represent Bell and Huntington Park and Southgate and Maywood and Cudahy and Vernon and the southeast cities. And I'm very proud to do so. So I want you to know where we have been and where we're going. In March, as you all may recall, we were forced to close our schools on campus because of the pandemic. I know you know how challenging it was. Our teachers, our staff, almost overnight had to adjust to a new way of teaching, and all of our young people had to adjust to a new method of getting instruction. I know many of you were nervous and scared, really scared of what the future may look like. But let me say that as we continue planning for the hybrid model, we will always prioritize health and safety of our students, our staff, and our families. Today, our special guests will address hybrid learning, tutoring, additional support for our most vulnerable students, including special education. We will talk about testing and contact tracing, childcare and after-school programs, and the extraordinary cleaning procedures that our schools have begun and will continue throughout this period of time. So let me say that one of the most frequently asked questions to me is, if schools reopen, will there be an option for my child to continue with distance learning? The answer to that question is a resounding yes. But also, some people have asked me, will teachers still be able to continue to teach from home? The answer to that is yes also, but it will not be mandatory. It will be mandatory unless you belong to a high-risk population or if you feel unsafe. So basically, what we're saying is that when the schools are safe enough for children to come back, except for those teachers and classified employees who have underlying health issues, it's safe enough for our staff to come back too. Mr. Schmerelson, I think time has come for us to have you introduce our speakers, please. Mr. Schmerelson, I believe you're muted.
Oh, you are so right. You are so, now I'm free, huh? Now I'm good? You can hear me now? Yes. Okay, nobody said no, so I guess you can hear me now. Before I introduce our speakers, I'd like to know who is participating today. And you'll see these questions on the screen. So please type in the chat box if you are a student, or are you a parent? Are you an educator, or are you a community member? Who are you? So we're going to tally that and let everyone know. Wow. The great majority is, as you may have guessed, parents. 93% parents. That's fantastic. Fantastic. So at this point, I am delighted to introduce our speakers. And let me just name them. They are so fantastic, really. We have Allison Yoshimoto Towery. She is our Chief Academic Officer. We have John Han, Coordinator, Beyond the Bell Branch. We have Pia Escudero, the Director of the Division of Student Health and Human Services. We have Eugene Hernandez, the Executive Director of COVID Response. We have Sohail Katal, the Chief Information Officer. We have Lilia Montoya Herrera, the Director of Transportation. And with her, we have Janet Hutchinson. She is the Transportation Routing Supervisor. Of course, we have Mark Hovatter, our Chief Facilities Executive, and Anthony Aguilar, Chief of Special Education, Equity, and Access. All wonderful, hardworking people. I'm telling you, I see them in person. I know it's true. I see them. Great people. So we're going to now have our speakers speak. They're going to get 5 minutes each. And here we go.
All right. Well, good evening, everybody. Thank you so much for being with us tonight, and to our hosts, Ms. Goldberg, Board Member Goldberg, and to Board Member Schmerelson. We're so grateful that you've allowed us to be here with you tonight. We have almost 1,000 people, which is wonderful. And we're really going to try to give you a whole picture, like they've said, in terms of what return to campus looks like. So I'm going to share our screen here. This is the order in which we're going to speak, and we'll start with hybrid learning and instruction. I'm going to put this up first because this is the number, and sometimes when we're speaking, we might speak fast and you might worry that you didn't get a chance to get everything down that we were saying. You could always call this number to follow up, and there'll be many opportunities. We'll put this in the chat today as well for you to be able to contact us if you have questions after the session today. So my name's Allison. I'm the Chief Academic Officer, and I'm going to start with pictures today. If you start in the bottom left, you'll see a Zoom screen, and that's what we're doing right now. We're calling it distance learning or online learning. We want to be up in the upper right-hand corner with our students back in the classroom and, able to be together with their teachers. But in the middle, between online learning and being back in the classrooms like we used to be, we have what we call hybrid learning. And that is in a smaller group, socially distant, in a very safe way. And we're starting that already. And I'll talk to you a little bit about that tonight, and what some of those models could look like as we are moving forward. So I do want to call it to attention in the upper left-hand corner, our new logo, and it says students at the center. So that is something that our superintendent has really brought to us as part of our vision for our district, is to always remember not only our students being at the center, but the classroom and the school being the center of all of our work. So all of our slides tonight will be in English and Spanish. So you can find the language that you prefer. And this slide is meant to talk about the day in the life of a student in a hybrid model. As Ms. Goldberg said, soon you will be getting a survey as a parent, and it will be asking you, it'll give you information about the online option, and it'll give you information about the hybrid option, and then you can indicate on that survey what you would like to do. If you would feel comfortable sending your student back to school in a hybrid model, you can elect that. Or if you feel more comfortable having your students stay in the online model, you can also elect that. And In the hybrid model, we're really focusing on having cohorts of students, groups of students together, so that they can, just like a family unit will have a classroom unit in the hybrid model. So whether you're in elementary or secondary, we want to limit the cohorts and the groups to a manageable size. So let's say 12 students or 15 students at a time. And then the instruction could be partially online and then partially in person. That's why it's called hybrid. And I'll go into some of the examples later in just a bit about what that might look like. And again, you can opt in. If you start with hybrid and you decide this is not for me, you can opt back into the online only model at any time. If you decide that you want to start and continue online, then we'll have windows in which you can opt in to the hybrid model. And that'll be delineated before you take the survey so that you know, sort of like windows. Every 5 weeks or every 10 weeks, there'll be a window to opt in. In terms of teachers, life of a teacher, it will be similar that teachers will be teaching both remote and in person. They will have schedules that allow for stable cohorts or groups of students. And in the classrooms tonight, Mr. Hovatter will talk about how we've sanitized our classrooms and got everything ready for our teachers. And we do have teachers now teaching from their classrooms during distance learning. And we have lots of digital tools for our teachers and our students to use. They're supplemental to the core content online. We also have core content online for reading and math, and some really wonderful ways to engage students. I want to emphasize on this, I have just 2 more slides to show, that this is really a sample, only a sample, just to give you an idea. And again, in top in English and the bottom in Spanish. If you look at the light blue, that could be a possible schedule that we end up with, where there's a morning group, light blue, and an afternoon group for elementary, darker blue. And it could be that, you know, if you opt into hybrid, that you would have that synchronous instruction, your child would have that synchronous instruction every day for that morning or every day for that afternoon. And some students will opt to be 100% online. So they're really talking about 3 cohorts. This is a sample. It could be that we're still talking about how we're going, which model we're going to offer. It could be that we end up having a Monday and a Wednesday group, and a Tuesday and a Friday group all day. But it's going to be some format like that that we'll be offering as a district. And then for secondary, again, just a sample, but it shows that, again, there's going to be at least a cohort, a group A, a group B, and then a group that's 100% online. And that's designed, again, to make sure that we have these sort of families of students at school. And that's in case if somebody gets illness, that it doesn't spread to everybody. We kind of can contain it quickly so that students can be as safe as possible at school. And so this is a model where students are half day on site and half day online. And again, we have a model that's full day at school, Monday and Thursday, and full day Tuesday and Friday, and every other Wednesday. So before you make a decision, you will know which model so that you can make an informed decision. As a parent myself with 2 high school boys, we feel that that's very important. And the last thing I just want to say is that small group instruction and support is available to your children now. And our schools have been ramping up to be able to offer this virtually, for especially our students that are having difficulty getting to instruction online, our students with disabilities, our English learners, our students who may be in foster youth or experiencing homelessness. And we are offering one-on-one in-person tutoring, where kids and teachers take their COVID test, they test negative, and they opt to come to school in person to read or do math together. And that happens after schools during the week and at some schools on Saturday. Some schools are just starting that, so it will grow more and more. So be patient with your school if they're just getting that going. But we're excited about that. And I just want to get our students back to school as quickly as possible and safely. So with that, I'm going to turn it over to my colleague, John Hahn, who is an administrator with Beyond the Bell, and he's going to talk to us about supervised care for students during the school day. Thank you, John.
Thanks, Allison. Good evening, parents. Board Member Schmerelson, Board Member Goldberg, thank you very much for inviting us to share what we're doing right now with our supervised care for students. As Allison said earlier, the safety of children is our top priority, and we have actually started opening supervised care for our LAUSD employees, and we've been doing this for approximately a month now. And so we've been working hand in hand with CDC to make sure we're following guidelines along with district employees and assuring that we provide a safe environment for our children right now. Currently, we're only open for LAUSD employees, but we are in the process of opening for our foster and homeless children. We'll be identifying those students with the help of Student Health and Human Services, and this is going to be happening very, very soon, as soon as next week. I believe Superintendent made a press release today and informed the general public that this is going to be happening. Currently, our student care program is for students in TK to 8th grade. We're following CDC guidelines by keeping our numbers to 14. As Allison had mentioned before, we stay in cohorts, and the purpose of the cohorts is that if a child becomes or a staff member becomes positive, we're able to contact trace and inform those that need to be quarantined to be quarantined. Our hours are Monday through Friday, 8 a.m. to 4 p.m. And during those hours, we're able to support students with Wi-Fi access, breakfast, lunch, and a snack. We also know the importance of our kids connecting with our adults there in a safe environment. And so we ensure that those students not only are getting access to their distance learning, but we also have some fun activities for them to be a kid and have a good time. We look forward to expanding our programs, and when it's safe, we'll be allowing more students to attend. But currently right now, we're only supervising those children of LAUSD employees and targeted foster and homeless children.
So with that, I'd like to welcome Pia Escudero. She's our Executive Director of Student Health and Human Services to talk about wellness and the importance of social emotional learning. Thank you.
Thank you. I would like to turn my video on, and I think someone has to allow me to do that. I will begin speaking in the meantime. Let's see. I want to thank you, Board Member Jackie Goldberg, esteemed Board Member Jackie Goldberg, and esteemed Scott Schmerelson for inviting me today to speak to your community, to your parents, and it looks like there's employees and students in the audience. I have the tremendous honor of working for Student Health and Human Services. We have a variety of very dedicated professionals at different levels of the school district. One group works at the school site, other groups work at our district operated clinics, and then we have groups of itinerants that float around from schools and offices and so forth. We have an array, it's over 2,000 employees that I supervise. We oversee wellness programs. We oversee district nursing, human relations and diversity and equity, positive behavior intervention and supports, pupil services, school mental health, student medical services and Medi-Cal programs, and student support programs. What I'm most proud of our team is that we work interconnected. So you may see someone that is working on attendance, but will refer the family for other services as needed. And we really try to do as much prevention. We also screen, and we address individual and family and various barriers that interrupt instruction. Next slide, please. What we've done right after we went on a virtual learning model is we launched our hotline. I encourage anybody to call our 213-241-3840. There are 8 options, so you can call for mental health, you can call for basic needs, whether it's food or health insurance or anything that is needed in your home. We have nurses also online, and we have help with enrollment, housing, and a variety of services. That is staffed every day, and we are we're able to support teachers and school staff if they need any type of services. Next slide, please. All our goals are really to ensure that our children are attending school 100%, so towards graduation. We support families in all different languages. We work with parents and community and student engagement, really focusing on 100% attendance, school safety, and other supports, using a lens towards equity and evidence-based interventions. Next. Again, there's a whole array of services. Each school has an opportunity to purchase these services with their school budgets, but we also allocate from the district. I won't go into the various details. I'll be speaking about that, I think, when we have some questions. Next slide, please. What we'd like for you to do is visit our website as well. Our website has tiles with an array of resources. We've just updated a slide, a tile about elections, how to have psychological first aid so you can able to listen to your children, protect, connect, educate, and model during these very stressful times. We have information about immunizations, which are really critical. We're focusing on kindergartners and middle schoolers having their immunizations completed and up to date. That's still an expectation from the state. And we have also an enrollment period for families that need health insurance, mental health. We have counseling. We have school mental health that has clinics, and they're having a very, very positive experience using telehealth. We seem to have a lot of families interested in parenting classes, so please call us if you would like to receive individual or parenting classes as well. And I just want to put a plug in. We're hiring nurses and LVN. So if you know somebody who would like to join our fabulous team in the district, we're doing everything possible to staff all schools and all our programs with the right nursing support. And I want to highlight that we have a campaign right now, and it's called Resilience Daily Campaign. That tile, if you go in there, there's exercises and things that you can do with your children. We are talking about every day, because so many of us are feeling overwhelmed, and there's so many feelings that we can't control, that every micro step we take towards resilience will help us to bring us back to our healthy baseline and to do well, because it really is overwhelming to address all the issues that we're talking today and just everything that is happening. So we encourage you to call and be able to connect with our support staff, and we encourage you to ask us if you have specific needs. With that, I am honored to introduce to you my boss and fearless leader, Tony Aguilar.
Thank you, Pia. And I too want to begin by echoing the sentiments of my fellow panelists here and thanking Board Member Schmerelson and Board Member Goldberg. As a parent of an LA Unified student, I know the importance of these town halls, and having an opportunity to share information out with parents is such a crucial need that we want to be able to fill. With that, I want to be able to provide you with a quick update on our COVID tested initiative. As many of you know, we have launched a full throttle effort to support all of our students and staff to have an opportunity to re-enter schools as safe as possible. In just a few minutes, I'll hand off to our Executive Director of COVID Response, Eugene Hernandez, who will go a little bit more over contact tracing, which is for us called community engagement, as contact tracing is an actual unique field that is done by the Department of Public Health. So really quick, we've amped up and really ramped up efforts to increase appointments available. We've made it available and easy for our families and students to be able to schedule those appointments, being able to kind of work with our technology partners to make sure that this is an accessible item for them. We've also expanded our capacity. You know, we have many of our people who come to us who may have been pre-exposed or may be symptomatic. We have an opportunity now to offer that kind of test to get a better understanding of baseline data amongst our community. When this slide was created, we were at 70,000 tests administered. As of today, we're at over 80,000 tests administered. So here's just a quick glimpse of our testing phases. So in that first phase of collecting our baseline is we're testing, the tested included employees who are currently working at the school site. So those who are volunteering, our teachers who are volunteering, our administrators, our SAAs, our office techs, our BGWs, plant managers, and also the employees and of the children that are participating in our extended daycare program. We're also testing those who are participating in our testing centers, as well as those who are working at our extended daycare sites. Our phase 2 is really kind of getting into asking our teachers, even those working from remotely, or even our administrators who are working remotely, to come in to have an opportunity to test. Our third phase is that phase-in approach, a little bit of what Allison was sharing of the services we're starting to provide, such as our one-to-one tutoring or in-person assessment. We're opening those doors up so that we can have our students and staff tested prior accessing the campus to ensure that we're reopening as safe as possible. So the additional efforts, I think we're hearing from our community the needs of what we need to do to try to expand our efforts. So we are working on extending hours of certain testing locations. Many of our families have informed us that, you know, with working hours, it's challenging to try to get there before 4:30, before an appointment. So we're trying to make sure we're accommodating all of our school communities. And so, and with that, also offering our Saturday testing at certain specific sites. As soon as we are able to gather up the teams to be able to mobile and be able to move around, we'll be having some opportunities to expand at school base. So maybe the local school community, or maybe the elementary school that your child attends, would also be doing what's called a pop-up site to be able to offer testing. Ultimately, our goal is to create traveling teams so that when we're in a hybrid environment, we can be nimble and really pivot quickly to be able to test communities where we're starting to see an impact of the infection. Next slide. And here I want to hand off to our Executive Director of COVID Response, Mr. Eugene Hernandez. I don't think we're able to hear Eugene.
I'm not hearing him either.
Got it. If you want, Eugene, Eugene, no worries. If you're having audio, I'll just jump right in. So I'll jump right in if we just stay right there. So really quick we're also, as I mentioned earlier, community engagement is our version of contact tracing. Again, contact tracing is a very specific role that the Department of Public Health plays. What we do is be able to have kind of a side-by-side opportunity to get information from our school community. So the question is, you know, the test results come back to the district, now what? And many of our families and our community members have asked us about that. Next slide, please. So just again, we quickly, once these results come in, they come into a database. We have staff ready and monitoring the results from 5 a.m. to 11 p.m. So as the laboratory is providing us these results, we're moving quickly and acting on those positive cases. And what our community engagement team is doing is contacting those individuals who have already been informed via an email that they had a positive case, and now we were instructed to quarantine or isolate. However, if just in case they have not been able to open their email, we'll follow up with the phone call to make sure that they're aware, and we're able to give them the instructions and directions that they may need, as well as answer any questions that they may have. Once a person is identified as positive, we basically will reach out again, talk with their different household contacts, and then this case will continue to be monitored by a nurse until it's resolved. So we want to make sure that the positive individual has that basically, for all intents and purposes, the virus has run its course and therefore is no longer contagious. Next slide. Oh, and I think this is where I hand off to Sohail Katal, who will be going over some items.
Thank you, Tony. And good evening. I'm Sohail Katal, Chief Information Officer, the person probably responsible for all of the complex situation that you have with your devices at home. I'm just like you, a parent, dealing with all of these situation and complexity that the device bring to your home. And I'm here to help and address all of those. I want to thank Board Member Schmerelson and Vice Board President Jackie Goldberg to give us this opportunity to directly essentially get in touch with the community that I have a privilege to serve. When we come to the technology and the devices, the first thing that comes to mind, number one, is devices. When we started the COVID testing, after COVID testing, when we started our activity, we had 3 goals, and those 3 goals: get every student a device that they can use, and get them connectivity that they can connect, and also get them the support that they need. Obviously, this was a very complex effort with a lot of students that we have, but with the support of the board and privilege that we had through the funding approach that we had, we were able to start the distribution. At this moment, we provided every student with the device through their school. If they have a problem with the device, they just can go back to the school, to the principal, and request a replacement or repair on their device. There is enough device, there is enough connectivity and hotspot in the schools to support the students and education. During the device deployment also, we made sure that these devices are become a device they are functional. The years of the device, the times that the device that they can run in multi-year support, they were part of the consideration. We made sure each device has a lifespan of less than 3 years when we deployed them. Again, if there is an old device that you're using and have connectivity problem with that device, you can return it to the school, and the schools have enough devices to replace those devices with the brand new devices. The type of the device typically was based on the instructional program in the school. Some schools, they selected the Chromebooks, some schools, they selected the Windows devices, and some schools selected the iPad devices. Most of them that we noticed was related to the iPad was the product of choice for early elementary, like grade 1 and 2. And the latest distribution that we have for early ed also was mostly aligned with that. And the iPad devices was selected by the schools for that purpose. But technically, these are mostly aligned with the school's instructional program. There was no essentially enforcement of the type of a device for the schools when we completed this distribution. Next slide, please. So the second piece was the connectivity. As I mentioned, the first part was the devices that were securing the funding within the district we were able to overcome. When it comes to connectivity, we know it's very complicated situation because connectivity was never core function of a district, a school, to provide connectivity for the public. We are educational entity. Now we enter into this era that we need to make sure a student can connect and serve their needs. We ended up partnering with vendors, with outside vendors, and with some other partnership across to be able to secure contracts, partnership, and agreement to provide these hotspots to the families and the students. The hotspots, as we don't, they are wireless internet connectivity. If the parents already have an internet connection at their home, probably they don't need a hotspot. But if they do, they just need to request from their school, and the school provide a hotspot for the student. It's not per household. I repeat, it's not per household. It's per student. If 2 students living in the same household and one hotspot doesn't serve them because they have too much instruction and homework, each one can request a hotspot from their school, and the school are providing it to them. Another thing about hotspot, we know that there are coverage across the hotspot. So our main contract is with the company Verizon. If your neighborhood has a coverage of Verizon, then you are in a good shape. If you don't, the second alternative product is from T-Mobile. Therefore, if you have connectivity issue, just return the Verizon and the school will provide you with the T-Mobile hotspot. So you shouldn't have problem with the coverage. If none of these solutions work with you, again, reach your school and the schools will help to provide different accommodation for that parent that they have problem with both of the hotspots. Those are situations that would be rare because these are the two biggest providers in this in the county. The last section is essentially about the support that we're providing for our students. Some of this support is about the cybersecurity, how we protect our devices, make sure they are filtered, they are controlled. This is our obligation to make sure the access is limited to the instructional material. And the second part goes back the support of the replacing and repairing of the device, which, as I indicated, is just a matter of the parent returning the device to the school for repair and replacement, or if they have a problem in that sense, they can escalate it. During this process, we also added the support of the Schoology and all the instructional app. We have a hotline. The parents can reach the hotline for any support. It's not limited to the technical support. Any support they can reach in that hotline, and then they can get the call can be diverted to the proper support. I probably forget to add that hotline number over here, but I repeat here, and at the end of the meeting, I will have the team to distribute it. It's 213-443-1300. 213-443-1300. That's a hotline number for any support, including technical support. With that, I will hand it to Miss Lilia Montoya to address the transportation.
Thank you. As we're going to transportation, I just wanted to pop in and again, thanks Sohail, because we made a really intentional effort for three things. One, we wanted every student to have a device. Two, we wanted every student to have connectivity. And three, we wanted every student to be engaged in learning. And so with his leadership, he really helped us to be able to do that. And whether we're online or in a hybrid mode or we're back in school, we're going to be in a much better place with technology and being able to integrate that and engage kids through technology. So I just wanted to thank you for that. And now we're going to turn to transportation with Miss Lilia and Janet. They're going to walk us through what that hybrid looks like, getting kids to and from school, and then we'll go on to our safe facilities. Thank you. I'll turn it over.
If the host can allow Janet and myself, please.
I'm good.
Next slide, please. So thank you. Good evening, parents, and thank you, board members Schmerelson and Goldberg. This is Lilia Montoya, the Director of Transportation. I'd also like to introduce Janet Hutchison, my colleague, the routing supervisor for our transportation department. I'd like to review some of the questions that our community and students may have in regards to what school busing may look like as we return back to campus. We have reviewed and are basing our practice as we look at the hybrid plan according to the County of Los Angeles Department of Public Health recommendations. These recommendations are here to ensure physical distancing of students on school buses for their safety. And what this will look like is, and the next slide will also show what that looks like, what it looked like last year and what it'll look like with the hybrid plan unless things change. So basically at this point right now, we're looking at a maximum of 1 child per seat. We have different size buses, as you may see out on the streets. The smallest has a capacity of like 16 students, up to 84 students being the largest. But we are basing this on seats and not on capacity. So therefore, on a smaller bus, you may see up to maybe 8 students. On a larger bus, you may see up to somewhere about 22 students, depending on the year and manufacturer of the bus. Face coverings will be required at all times prior to boarding the bus, on the bus, and also as they step off the bus. To ensure the proper circulation of air, we will have air conditioning on, and this is also permitting that, taking into consideration if there's any restrictions with any students with any restrictions to air or heat. But otherwise, we will have the windows down and the vents down as recommended. Next slide, please. And, just to give you a visual of what this would look like during, the normal times before the pandemic, the first on the left, you can see that on this bus, normal seating capacity may be 52 students per bus. Well, underneath that, you can see what this will look like. And this kind of gives you a perspective of, the precautions and what we will be implementing once we return back to campus. This is on a regular bus that does not have the wheelchair components or the lifts. Next slide, please. On this slide, it gives you a perspective on what it would look like on the buses that do have lifts and that can accommodate wheelchairs. And as you can see, there is the social distancing. It really limits how many students will be on the buses, and there will be precautions also taken and information that will be delivered for the students that cannot wear masks, and face shields or other coverings will be required. And also there will be more communication from our office of special education regarding the process that will need to take place in order to make sure that we are making sure that all of our students and employees are safe. Next slide, please. I will then, Ms. Janet will make sure that she will go over this with you.
I do have a couple of points. That's not our slide, but I do have a couple of points that I'd like to point out. We heard a concern about the homeless, the students that are experiencing homelessness and foster students. They are and always will be our priority as long as we are able to transport them on a yellow bus. Now, if we are not, due to whatever circumstance exists, they will be given tap cards. But first, what they need to do is they need to contact the homeless office. And if you go back a couple of slides, we have the number there for the homeless office. If you could go back a couple of slides. Oh, right there. Down at the bottom, the last bullet, it shows the number to call, and they determine whether or not you're eligible to be in our transportation program. If your child is an elementary student, you must live 2 miles from your school of origin. And if you're a secondary student, you must live 3 miles. That's when you would be able to utilize the school bus or to receive a tap card. The other thing that I wanted to bring up.
Janet, I'm sorry to interrupt. That number does not work. What will work if they call 213-241-3840, option 8. That is our standing office, and there's no one at that office. So
Okay.
they have to call our Student Health and Human Services, 213-241-3840, option 8. Thank you.
Thank you, Pia. The other thing that I wanted to bring up, I've received some concerns from parents on sanitizing the buses. The buses will be sanitized after each trip. So if we bring in your student in the morning for an 8 o'clock, for an 8 o'clock bell schedule, immediately after that, we will disinfect the bus and before we go pick up any other students. So after each trip, the bus will be sanitized. And those are the points that I wanted to bring up. Hopefully that'll quell any questions that parents may have.
Thank you, Janet. And yes, and to add to this, then at the end of the day, the buses will also be sanitized. So at any point, any type of transition from one cohort to the other, we want to make sure that, you know, our student and community populations are aware and also are assured that we will be sanitizing our buses in preparation and for the next group to make sure that our buses are clean. And with that, I thank you for your time, and we will transition over to Mark Hovatter with facilities. Thank you.
Thank you, everyone. While our instruction team and transportation have done a good job trying to minimize the number of people that are exposed to each other, we still want to do some things to try to assure that we're keeping people as safe as we can. Our focus area is really going to be on two things. Let's minimize the number of times people have to touch something that someone else touched, and let's minimize the chance that someone has to breathe the air that someone else has exhaled. I mean, those are our main functions. And we do that by having everyone wear masks. We do that by trying to keep people apart, 6 feet apart. And that's going to include in the classrooms. We're going to make sure that our desks are not within 6 feet of each other. We are going to clean everything. Every night, we're going to go in and do an electrostatic cleaning. We've bought over 1,000 electrostatic machines, and basically this takes our disinfectant. It ionizes it, it breaks it into very tiny particles and gives it an electrostatic charge. So that mist will go out and wrap itself around everything. So when you're using a rag and you wipe down a flat surface, it's kind of hard to get every single nook and cranny. But with these misters, it covers a microscope, it covers a keyboard, you know, it just wraps itself around and collects to everything. That's going to happen every single night. We are bringing in additional custodial help that's going to help us. Essentially, we are doubling the custodial staff that we're going to have at each school to make sure that we're touching all the high touch areas and that they get wiped down. High touch is in, you know, doorknobs, door handles, elevator buttons, those type of things. But in addition to that, we've actually modified our air conditioning systems. People ask us if we're going to provide special air filtration, and the answer is yes, and we're going to use our air conditioning systems for it. We have taken all of our filters, and for every classroom, we're going to replace them with MERV 13 air filters. 13 is the number of rating. The higher the number, the more particulates it pick up. Normally, we use a MERV 8, and we change them every 4 months. We're going to upgrade to MERV 13, same air conditioning they use in hospitals. It's made from the same elements that they use to make the N95 masks. And then we are going to inspect them once a month and make sure that they don't need to be replaced. If they need to be replaced, we will replace them. The other thing that we've done is we've rewired our heating and air conditioning units so they run 24/7. The fans run. Doesn't mean the compressor's running and it's blowing cool air, or the heater it's running hot air, but the fan is running because it's recirculating 100% makeup air, which means that every time the air gets sucked out, an equal volume of new fresh air is getting pumped in, and it runs 24/7 so we can maximize the air that's going through and into our systems. Next slide, please. On the classroom size, how are we going to keep 6 feet apart? In some instances, we're moving the desk out 6 feet apart and taking other desks out. For some circumstances, our principals prefer that we leave the desks in because we'll have 2 different cohorts and they won't have to share a desk. It's just we'll have row A and row C occupied, and then row B and row D will be occupied the next day. But when we do leave those desks in, it's going to be clearly marked and designated, either do not sit here, or it'll be color coded so they'll know which day everyone's supposed to be sitting in. With the spacing of our classroom, depending on the size, it'll be 12 to 15, whatever we can fit in there, not to exceed 15. That will allow us to keep everyone that's at least 6 feet apart. Next slide. Here's a picture of what it looks like. You see the do not sit here. Notice the front row has a do not sit here on every single desk. And that's because we want to leave room for the teacher to be able to walk back and forth, to be able to address the students and not hide out in a corner, but yet still be at least 6 feet away from everyone so they can make eye contact. It just gives a bumper level so they're able to move about the class a little bit more. Unfortunately, it's not appropriate for them to go back to each desk, but at least they can move back and forth and stand in front of them as we're doing instruction. Next slide. And then this is another scenario we might have where we just take the extra furniture out of the area. So there's a limited number that's set up. Next slide. MERV, I mentioned before, minimum efficiency reporting value. It's just a rating. The bigger the number, the more effective, the more particulates a filter will trap. We're inspecting them every month. These filters are considered hospital grade. It's the same level of filter they're going to put in an operating room or recovery room of a hospital. Next slide. What plan do we have to open windows in classrooms and adding fans? It's interesting. Normally, because of we're big energy conservation people, we'll go over and scald a teacher if they're leaving their windows or door open while the air conditioner is running. That doesn't happen anymore. The most important thing we can do is get as much air as we can into the room, as much fresh air. And if it helps to get more air in by opening those windows up, that we're going to do that. If we need to bring more fans in addition to our HVAC systems, HVAC has always been important to us, and it's always been a critical repair. It's now been elevated to super critical. We've got more contractors on place to supplement our in-house people. You know, we send the squad out as the highest priority if there's any reports of any air conditioning down, to make sure we're getting those up as quickly as we can. We've got some backup air handling units, backup fans, backup purifiers if we can't get to it immediately. And if we can't get that air back up, then we're going to have to move the kids out and potentially put them in an outdoor classroom or something else where we don't have to have them in a room where the air is not working. Will everyone be given N95 masks? Everyone will be given a mask. Understand, N95, it's the highest grade of mask. It's actually considered a respirator. To wear an N95 mask, officially, you are supposed to be fit tested, which means you have a medical professional evaluate you. And by fit, it means make sure the mask fits on you, but it also means your physical fitness. And N95 restricts the air so much that if you have a respiratory problem or you struggle with breathing, if you're not getting a high volume of air, then it's inappropriate for you to wear, and it can actually do more damage to you by not getting enough air. So we do not put N95 masks on everyone unless it's a requirement. Certainly healthcare professionals, someone that's going to be interfacing with a lot of people a lot of time, the people in the testing area, people that are preparing food, those type of things will wear N95, but we are not encouraging N95s for everyone. We will make sure everyone has a mask. We've got disposable masks we're going to issue. We'll ask people to bring them every day. They're reusable. Of course, we understand that some people aren't going to remember to bring them every day or something might happen. We have lots of extras. We have been very good at stockpiling them. There is no shortage for us. We have millions in our warehouse, and we make sure that we've got at least a 2-month supply staged at every school, so there's not really a danger that we're going to run out. Next slide. Desks and services be sanitized between each passing period. I mentioned we're going to increase our custodial staff. We're literally doubling our custodial staff at each school when we bring our students back. So we're going to have half of our students on board at any given time, and we're going to double our custodian staff. So essentially that means in a custodian to student ratio, we're going to be 4 times higher than we would be under normal circumstances. The focus is not on cleaning, the focus is on sanitizing. And we're looking at the high touch areas, tables, doorknobs, light switches, elevators, buttons, you know, anything that someone else might have touched. We've got a whole crew that's doing nothing but wandering around and making sure that we're repeatedly over and over again touching all of those spaces, wiping them down, disinfecting them. In between every change of classroom, we're going to go in and wipe down every one of the desks to make sure that they're sanitized, so no one will have to come into a desk that someone else has sat in before them without being sanitized. Every night we're going to use our electrostatic machines and go through every single classroom to hit every surface. Bathrooms are going to be enhanced cleaning. We are, first of all, going to block out every 3rd stall, or block out 2 out of 3 stalls just to keep people separated, and sinks to keep people separated, which means there'll be more use. So we have to go in and wipe down those high touch areas more often. Everyone will get a full cleaning twice a day, plus at the end of the day, it gets a 100% sanitation. Our next slide. You can see some of the directional arrows. We're putting lots of signs in. What we want to do is not have people have to bump into each other while they're walking. So we're going to be pretty strict and traffic cops about how people walk. You have to stay to the right of the hall as you're walking down. The stairway, you can't walk down on the same side someone's walking up. We're actually going to have some doors that are exit only, some doors that are entering, some doors that are enter only, and lots of signage things that say, you know, do not drink here, do not enter here, do not pass here. Our drinking fountains, we physically are going to be wrapping plastic around the bubblers. We already have, and we're not going to allow people to drink out of our drinking fountains. We are going to ask everyone to bring their own water every day, but we're going to recognize that either someone will forget or something will happen, or they'll drink more water than they bring. So we are going to have bottled water that's available to hand out to people. We have gone so far as to only order the very small bottles, because we want you to drink the water all at once and then throw it away, and not carry around a disposable water bottle because they all look alike. And we don't want to risk someone grabbing a bottle thinking it was theirs when it was someone else's. So the bottles we issue will be the smaller type bottles. It's a little less environmentally friendly, but today our focus is on making sure that we're keeping all our students and our staff safe. So we'll try to encourage everyone, if they're going to use one of the disposable plastic bottles, to drink it all at once and then throw it away, so we don't have to worry about that cross-contamination. Next slide. Again, just to reiterate, our schools have been infected. Understand that we've been back at school. Our schools have been open while students have been there. We've had limited number of staff there. However, our custodial staff has not been limited. Their full allocation of custodial staff has been there. They've sanitized everything top to bottom, gotten lots of extra cleaning. We continue to do that. We're going to double the number of custodians, which will quadruple the number of custodians per students. So to make sure we continue to do it. And every single night, our primary focus is going to be make sure that every part of that school is disinfected with the special teams that we have there. So at this point, I get to reintroduce Tony Aguilar, because we haven't heard from him enough tonight. So Tony, if you can bring us home, please.
Thank you, Mark. Always a pleasure. I'm returning now with my special education head, and I just want to be able to offer just some words to our parents and our families with students with disabilities. We're working diligently with the Division of Instruction and with my colleague, Chief Academic Officer Allison Towery, to make sure that whatever we're offering our students in the Gen Ed, we're making sure that we have that offering for our students with disabilities. And then the added more of which students with disabilities also receive. So all that to say is, during this time, we're going to continue, whether it's distance learning, which is where we are now, we are continuing with offering the services to all our students in accordance to their IEP to the best extent possible. Also, to ensure that we're providing the services they need, we are asking all service providers to track all of the services that they are providing to their students, so that we can be able to gauge on those that may need it or those that may have not received it, and be able to backfill and provide those services. We don't want any student during this time to go without any services. And lastly, we are continuing with our virtual IEPs, and I'll talk a little bit more about that towards the end of this slide, towards the end of this presentation. Next slide. So again, we want to be stressed to the fact that we are ensuring equity. This is really about offering our students with disabilities the best opportunities and programs we can in this environment. So what is it going to look like when we're hybrid and we're still offering online? Again, we want to make sure that we have everything addressed. So ensuring that we have a distance learning plan that is in alignment with Senate Bill 98, so that we can continue to deliver services in emergency conditions like the one we're in now. The division is also implementing in-person assessments, as well as continuing to complete assessments that do not require in-person assessments. So we are in the process of rolling this out and trying to make sure we do this in the safest way and manner as possible. And again, as Allison mentioned earlier, we are offering one-to-one tutoring at our sites for our students with disabilities. Next slide. So I just wanted to, I got a lot of questions regarding assessments during distance learning, and many people have heard that what can be done, assessments cannot be done, and it's impacting our students and the services they can't they should be getting? The answer to that is we do have an opportunity to do assessments during distance learning. So the special education teams at each of the sites collect, review, and consider all relevant student information in order to complete the assessments. So we recognize that there are certain assessments that must take place in person, but we also recognize that there's certain information out there that can allow us to get the data we need to be able to provide the students the services that they require. Next slide, please. And then, so with that said, is now that we're starting to get have more opportunities to open up with the new county guidelines, is we've started to implement we're starting to implement our in-person assessments. Again, we're trying to ensure that we follow all of the safety guidelines that were provided by the Department of Public Health, and ensure that we have everyone participating in our COVID testing initiative. Next slide, please. So just again, the silver lining to everything with this is our virtual IEPs. I really want to commend our division heads in special education who worked diligently to ensure that no matter what environment we were in, we were going to continue to have opportunities to meet with our families to ensure that our students were getting the services that they needed and the placement options that they needed. I have heard back from many stakeholders and really liking this opportunity, whereas they can have multiple people in different areas participate in the child's IEP, whereas before you were limited to that physical location. So I just wanted to give you a glimpse of where we are in conducting our virtual IEPs, and a commitment that I also want to share with all of you that even in an in-person environment, in a post-pandemic environment, this is an option we want to continue to offer just because of the accessibility it has provided our families. With that said too, as we're starting to look into ways to continue virtual IEPs, as we begin to open doors, we will also look into maybe doing a hybrid version of IEPs too, meaning that to provide some in-person opportunities for people to attend IEPs, obviously as safe as possible and in room spaces that are big enough to accommodate, as well as offering that virtual setting, if you will. Next slide. We have a contact, and I want to stress this, we have an opportunity to gauge really quickly if one of our students is not receiving a service. We have a hotline at 213-241-6701. And that allows us to really remedy a situation that we can capture. We look at a ticket and are able to respond to it. And I personally, as well as through my senior director, we make sure that those tickets are closed. And if any open tickets, we try to follow up and ensure that we're addressing the needs of our parents in our community. Next slide. And I'll close out, I think, here with our general hotline number, that I think Sohel has mentioned, Allison has mentioned, and during our COVID, our COVID experience, we wanted to make sure that we had a one-stop shop, if you will. And so that number is 213-443-1300. And so that we have several different options, including finding out more about the services or COVID testing or any other needs that our families may have. And with that, thank you. And I think I turn back over to our esteemed board members to take us to, I think, a Q&A session.
Hello, yes, indeed we are. And first of all, I want to thank all of you who have come to us as experts from our district. You have managed to give us more information. I was trying to take notes as fast as I could, but I want to remind everybody that these things will all be posted on Mr. Schmerelson's and my Facebook. So if you missed anything, you can watch it again. Now, we are going to try very much to take along and do some things here now to talk about what's going to happen next. I want you to know from this presentation how much effort and preparation and planning it will take for us to get open. That's why nobody can say, oh, we're going to open tomorrow. No, we're not. In fact, we can't open at all until the COVID crisis comes down. But even when it comes down, all of this planning and preparation will make it possible. Now it's time for our Q&A session. I'm going to be asking the English questions, and Board Member Schmerelson will be asking the Spanish questions. Our speakers will speak in the language they're comfortable in, and you will be able to hear it because you've used your interpretation box. Please make sure you've selected a language, even if you're bilingual. and using the interpreter section down below.
Jackie, before we start, may I just mention one thing to parents? Because I too have been following these questions in the chat. They're the most fantastic questions I have ever seen, and they really need to be answered. They do. And when you said this is recorded on our Facebook pages, and it's so good, parents can watch it again and fast forward and slow it down to the parts they want to see. My team will make an effort to get these questions in the chat, divide them up according to the different divisions, and get an answer for people. So just be patient with us. We're going to do that, okay? Just so everybody knows. All right, thank you, Jack.
And the reason that Board Member Schmerelson said all of that is that we have many more questions than that we're going to be able to answer tonight. But we are not going to stop in either office until we get all these questions answered. So the first questions I have are for Allison Towery. And one came from Maritza, and she asked, what type of curriculum will there be for middle schools for physical education?
That's a great question, Maritza, when we think about being hybrid or distance learning. So PE should still continue. We want, I don't know about you, but after some long days, you know, I feel like I just need to move. We need our kids to continue to be physically active and understand, you know, how to take care of their body, their health, their nutrition. And so the curriculum itself hasn't changed. We have something called WellNet. It is an online software that many of our PE teachers utilize to teach PE and to get students active. It has lessons on there and kids can track their physical activity. Some teachers just use a log. They have parents, sorry, you can hear my dog. They have parents that sign in on their logs and things like that, and that's very doable. We want to encourage PE, although the minutes themselves have been waived at the state level because we normally have a very strict requirement, and it's hard for us to measure right now. So we just want to ensure that it's continually given to students to do. But of course, we're not with them to watch them always do the PE. So WellNet is the name of the curriculum. We also have a number of supplemental programs, and you can email me at instruction@lausd.net if you want to have further information about that. Thank you.
Okay, and are there going to be exemptions from testing for special education students?
Tony, do you want to take that one?
Actually, okay.
So I absolutely can take that one. So I'm wondering the testing, if it's COVID or if it's academic, but I'll address them both.
I think it's academic.
Okay, so for academic testing, if everything is in accordance to a student's IEP, so ensuring that we can offer assessments that can accurately give us, the present level of performance for student is something that we will require. But again, everything is a case-by-case basis with students with disabilities, as they do have IEPs.
I can say for all students, including with students with disabilities, we do have assessments this year. We actually have some newer assessments that can be given for students in elementary for literacy and math. It's called the DIBBLES for literacy and Edulastic for math. And they're taken on the computer, and they're to help the teacher understand, where our students are, what they've learned, what they need to learn, and to really guide instruction. And at the secondary level, we have assessments called Renaissance for both English language arts and math. And then, of course, for our English learners, we also have assessments as well. We are giving the LPAC now, which stands for English Language Proficiency Assessment.
Ok, tengo una pregunta de Alex. Y Alex dice, ¿cómo pueden recibir los estudiantes ayuda para hacer la tarea?
How can students receive help for their homework?
Is that a question for me, Mr. Schmerelson?
Yes.
Okay, I apologize.
I'll say it again.
My translation wasn't working adequately.
Sí, ¿cómo pueden recibir los estudiantes ayuda?
How can students receive help for homework?
Aha, thank you. We have made, thank you. Thank you. We have a number of opportunities for homework. One is that all of our teachers, first and foremost, contact your child's teacher, right? We have educators on the call today. Our teachers are always know our students best in terms of what their needs are. We also have, so there's small group tutoring after school. Again, at many of our schools have started. Some are ramping up to start in the next couple of weeks. So that's something that we're offering to our students. And we also have many of our supplemental materials, not necessarily with homework per se, but in learning material. Kids can get online, they can jump onto Brain Pop, they can learn lessons. They can get onto Edgenuity and learn about, take reading lessons. So at every level, we have different games and software and lessons that students can take when they're not with their teachers. And also with the public library, all of our students have homework help through something called their homework help. So again, just email me at instruction@lausd.net and we will get you connected if you don't know where you're, if you haven't gotten your child's library card, it's called a student success card. We can get that for you and your child can have help. I think it's 12 hours a day until 11 o'clock at night. There's somebody online that can help your child with homework.
Okay, let's see. Okay, otra pregunta para
Another question. Allison, the question is, how will you make sure that students still have access to the curriculum those days that are not physically present at the school?
We have moved our curriculum online. So from March of last year, when we had to close schools, we did an analysis of what we had available. Our students all have a username and password. Our younger students have little codes that they can hold up to their cameras that can get them online to make it easier. And we have our reading, our math, our science. We even have music curriculum online for the older students that are taking those, and so all of our core curriculum and supplemental curriculum is online. And we've actually added quite a bit over the summer, some of that I've mentioned, but Discovery Education Channel is another one that can really keep our students engaged and our teachers are using. So there's a lot of curriculum online. So I have to say that our students do have the opportunity to use that and be patient. Our teachers have done an amazing job learning how to use all of that and teach differently. But they're now reporting that they're really getting into the groove. So again, I want to reinforce that we are going to be better off when we, in fact, do return to campus with technology, because we've all been using it now for 7 months and learning how to do that. So thank you for that question.
Okay, the next questions are for Mr. John Hahn. Dawn asked, what are the safety requirements to reopen the after-school programs like YS?
Nice. So we're not at a time to open up the after-school programs right now, but what we are doing is we're making sure our childcare programs are as safe as possible. All the students and staff members that are participating in the childcare program have been tested, and we're making sure that they are testing positive, and we're going to be testing them on a regular basis. We're also providing PPE for all of our students and our staff members, as well as making sure that hand sanitation and traffic patterns are followed and students are separated, and whatever necessary, the dividers are placed as well. And students are also not sharing any items together, and even when they're eating, we're ensuring that they're separated from one another.
Okay, otra pregunta para John Hahn.
Another question for John Hahn from Raul. What safety measures must the district follow for after-school programs?
Yeah, very similar to the first question. One of the things that we've learned is that the key is to wear a mask and to maintain the social distancing and not be too close to one another. I understand this is very difficult, especially with our younger children, but that is one of the things that we train our staff members on, to ensure that children don't share pencils or pens, also maintain that social distancing throughout the whole process. And if anybody, we also ensure that the students are asked questions. If you haven't gone anywhere, there's questions that are asked to everybody about, showing symptoms or being exposed. So if a child or a staff member is exhibiting any symptoms, whether it's fever or coughing, we go ahead and make sure that they go see a medical provider and are separated from the group until we can get that clearance.
Now we'll move to questions for Pia Escudero. Annalisa asked, will there be adequate nurse support at each school, to ensure that there's a health professional available to the children?
It's a great question, and we are doing everything possible to hire additional nurses right now and LVNs, but every school site is going to have a plan to address healthcare and support to address the needs of children.
Daisy asked, how will the district make sure children with underlying conditions such as asthma are safe? Will parents have to sign a waiver?
That's another very important scenario that we need to talk about, and that is we need to have the best communication between parents, doctors, and the school. So children who have chronic conditions, whether it's asthma, diabetes, or other medical conditions, we need to have that note from the doctor about special instructions. We're also going to wait for county recommendations as to what conditions may be better for virtual. If it's a very severe situation where the doctor is not allowing for hybrid, we will have to plan for that. At the same time, when we have the doctor's orders and it's asthma, we develop at the school site, administrator and the nurse, with the parent and the student, a healthcare plan. Who's going to administer protocols and what types of services we'll do. So we will be doing that, especially as we prepare for hybrid. I recommend parents start getting the right instructions from their doctors if they have not seen it. And if I may pitch again the importance of vaccination. Many times families during this period have not gone to their doctors, and vaccinations, immunizations are required for kindergartners and all ages as usual.
Ok, tenemos una pregunta de Bola. Bola quiere saber.
We have a question by Bola. Will immunization be compulsory or required?
The immunizations that are state approved right now and required will continue to be required. Usually we have a deadline November to have all those immunizations in compliance. We just received word from the state that we have until the end of December. So we have in the next 2 months to make sure that all children have all their early ed and kindergartners and middle schoolers vaccination up to date.
Ok, gracias. ¿Y cómo va a
Thank you. How will meals be provided to students in their free days?
I think that's a question for, I don't know who that question is. I think that the meals are
Actually,
going
I
to.
sent it to you, but I don't know if.
Oh, okay. Well, the meals are provided as usual, breakfast and lunch for those attending hybrid on their days that they're attending school.
On the days they're not, it was the question.
On the days that they're not, I think we'll have more information about that. We will continue with grab and goes, but we'll have more information about meal distribution on campus.
We are discussing having a outside place in front of the schools, that each school that will let people come and pick up meals for either students who are all online still or whatever. And I want to remind everybody, we're not talking about this hybrid soon. We're talking about it probably after the first of the year with the new semester. That would be my best guess. Okay, next we'll move on for either Eugene Hernandez, if we figured out how to hear him, or Anthony Aguilar. Gabriela asked, would at any time a child be tested without a parent being present or without consent? And I think they're talking there about COVID testing.
Absolutely, and that's a great question, Gabriela. As you know, before you are able to get a test, you have to schedule an appointment. And built into that appointment scheduler is a consent. And so parents would need to be consenting every time a student is being tested. So just want to assure them that a parent would know, they would actually be notified that their child would be tested if we're going through a periodic test. So let me backtrack. If you're doing an initial test, you as a parent will be notified about participation and therefore will schedule the appointment, provide the consent, and then take your child to the testing center to be tested.
And then Araceli asked, how will you ensure privacy and protection to a student and the student's family from the inevitable finger pointing and exclusion that results from a positive test of a child?
I want to thank Araceli for that question because that is something that we're working diligently hard to address. First and foremost, education is key. We want to make sure that people understand, you know, the effects of the virus. And so when someone has become impacted, we recognize that we have to try to support that person as a community, which includes in not that kind of finger pointing. However, the commitment from the district is because we also believe in being transparent and making sure that our community is aware of what is happening. We are working on having at least some type of public-facing dashboard that our community can have a quick glimpse at to see how many positive infections have been occurring in a community. That's important to note because that should be informing us about the prevalence, one, of the virus, and two, of what our safety measures should be to make sure that we're keeping each other safe.
Qué bueno. Y esta pregunta viene de
This
Sonia. Y Sonia,
question is from Sonia. Sonia wants to know about private doctors. Sonia says, if I do not want to participate at the district's COVID testing, how could I present my COVID testing from my medical provider to the district?
That's a great question from Sonia. Definitely the opportunity of which we would have is if a parent chooses or does not want to participate in COVID testing for whatever reason, if they just don't feel comfortable in using the district's facilities, we will have an opportunity for our parents to schedule an appointment with their own physician where they can actually have a COVID test taken. And the results could be provided to the district so that we could have records of that. And so this is just another measure that we're trying to support our families who wish to be able to come back on campus and participate, but not want to utilize the district's testing center. I will say that the results should be within 72 hours.
Okay, otra pregunta viene de...
Next question from Kili. Kili says, will it be required to download the application called Health Grade to come back to school? Will that be compulsory? Health Grade application to be downloaded to your phone.
Oh, I think I understand the question. So we do have a Daily Pass app. So I think that's the application of which the parent might be referencing. And so as you know, the Department of Public Health has mandated that we have health screening questions at every location before accessing a site. I mean, you're probably familiar with that when going to your own medical doctor or your dentist or any other appointments you might have. Because of that, we actually are building in something to streamline that process, and we will have a Daily Pass app where it's a questionnaire of asking those health screening questions also a commitment statement ensuring that we're going to adhere to safe practices at school. But it won't be mandatory to download that app to your phone because we will also have web-based that you can actually go onto your computer.
Obligatorio.
Right.
Sí,
So,
obligatorio.
Yeah, it will not, it won't be obligated to do it. You can do it on our website, so we can still have access to do it.
Thank you very much. Now we'll have questions.
Muchísimas.
Thank you very much. Now we will have questions for Sohel Katal. Alex asked, are student devices being properly managed and monitored to prevent students from going into malicious or adult websites?
Sure, thank you. So all of our devices, they have filtering system built in. For the iPad devices, we use a separate technology. For the Chromebooks, we use a different solution. And now we are in the process to transition both of them to the same platform for the ease of management. It is going to be seamless, and they're not going to have any impact on the community and the users and the parents. We make sure we get all the precautions, because this is a large number of the devices that we are working to make sure we improve our safety and security of the devices. But all devices, they have filtering system that prevent them from going to the site that they are designed for adults or other usage. And even in the YouTube, we are filtering them to just access to the instructional material and not to adult content in the YouTube.
Ok, otra pregunta, otra pregunta. ¿Cómo se
Another
van a
question: how the students from the early education students and special ed students could register in their iPads or computers in order to get access to their class material? Are they using the QR code, or are they, I mean, do you expect kids from 3 or 4 years old to use a password?
Thank you. That's actually a great question, because it was in top of our priority when we started the device distribution overall, and not just to early ed, also to kindergarten students. So at the start of the work, we deployed the QR code for all of our first and second grade students to be able, and kindergarten student and transition kindergarten. And they were all received the QR code through their schools, and they were able to log in with the QR code. When we got to the early education, we followed the same practice. But on top of that, extra support being provided by a school administrator. When the parents go to the schools for early education student to pick up their device, they're going to give more hands-on support to them at the time of the distribution. They're going to tell them how to sign off their devices for the first time, because for the first time, you need to access the device, and they are walking them through that process. So QR code is available for all early ed students and up to grade 2 of elementary student, and all of our special education student, regardless of the type of the grades or the education that they are in. They all receive the QR codes.
Thank you. And now we have questions for Lilia Montoya Herrera or Janet Hutchinson. Ruby asks, will more buses be fitted with wireless internet now that all students have one-to-one and devices?
That's a good question. That's actually a topic of discussion. At this time, I can't provide I want to give factual information, but that is something that is in discussion. Thank you.
So maybe.
Perhaps.
Perhaps, okay. Anthony wanted to know, can you create an app that will track student ridership so that parents will know where their bus is on a map to know if their child will be early or late, and it also will help students who might have a serious illness or condition?
Yes, and we're actually working on that, and we hope to have that rolled out by the time we return back to campus. So definitely.
Ok, tengo una pregunta de Kay. Y Kay dice, ¿se pueden utilizar los autobuses?
Kate has a question. Can the buses with points of cordless access could be used to give internet access basically for the communities, the low-income communities? Could the buses provide those?
The question is regarding access points for internet and to certain areas. That was also something that was being discussed. So we're looking at the security also, and the extension of that, the radius. So once again, that is part of the topic of discussion that we've had and are having with our ITD department.
If I may just add something to what Ms. Lilia added over here. Although we are recommending if the parent has a connectivity issue, first and foremost, contact your principal and they will provide the proper connectivity rather than waiting for the bus to be equipped and sent to their community. We can help them to get connected if that's the issue. I just want to mention. Thank you.
Oh, sorry, forgot to unmute. Mark, Tracy wants to know, will there be recess or unstructured play opportunities for the students? Will playground equipment be open on campus?
There will be recess. We want to get kids outside as often as we can. We will have the playground equipment roped off though. Anything that everyone would be touching repeatedly without us having an opportunity to go in and clean in between, we're gonna make off limits. So we're gonna have to look for some play areas that don't involve sharing the same equipment or touching the same things over and over again. They'll be able to check out a jump rope and then turn it back in so we can sanitize it before we give to the next person, or a basketball if they just want to shoot baskets by themselves, but they're not going to be able to play basketball games and those sort of things.
Okay, and now Amanda wants to know, why hasn't the district converted outside spaces into outdoor classrooms with microphones for teachers, tents, or maybe distant desks?
We're trying to do that as much as we can. There's obviously a space restriction because you've got to get people apart. There's facility issues as far as setting up tents and then taking them down. We are going to work with principals to give them as much outside space as we can. We want to try to get people to be able to eat outside, not inside of a cafeteria room. So we're going to get more benches. We're going to spread them out as far as we can, open up some of the grassy area and those sort of things. We encourage people to take advantage of those spaces as much outside as we can. We obviously can't do it for 100% of the students 100% of the time. So hopefully we'll go through a period where we can rotate through. That gives us enough opportunity to go in and wipe everything down and sanitize it between people using the same benches.
Thank you very much.
Y ahora Silvia me pregunta, ¿habrá dispensadores de jabón automáticos?
Sylvia asked me, would they have automatic dispensers or water sinks that are, these automatics that are disposable?
Many of our sinks are automatic already. We don't use paper towels. We use air dryers to the maximum extent we can. We're not going to be able to go in and change out every single faucet with automatic dispensers. We are getting hand sanitize stands with a disinfectant that have the foot pumps, so you don't have to touch it with your hand, so you can just pump it with your foot to get the hand sanitation as much as we can. Drinking fountains, we're not going to get automatic drinking fountains because even if we did, people might be touching the sides and it's a place that collects germs. So instead, as I mentioned earlier, we're going to encourage people to bring their own water or use the small disposable water bottles that we'll provide.
Okay, well, thank you very much. And now, Mr. Anthony Aguilar, a question to you from Monica. Can parents who decide to keep their special education students at home do so without worrying that the school will deny providing them related services remotely, like speech therapy, OT, and other such things?
Much like we mentioned earlier, we're always going to make sure that we have options for our families to choose from the hybrid or in-person. All that to say, though, whatever service that we are providing or whatever mode that we're delivering the service, we're going to it to the best extent possible, meaning that students that require or receive related services, if we have that opportunity, they selected to come on our campus, we'll be able to explore the opportunities that are offering in person. For those that are offering or staying virtual for whatever reason, we want to make sure that we also continue to offer the opportunity to make sure that that's available to them. So we don't want to have any service stop just because of the option that a parent chooses.
Thank you. And now Elisa wants to know what types of waivers are there to allow career transition schools for special needs students to reopen with a hybrid option.
Currently, there are no specific waivers for career transition schools. However, as we as a district plan to return to hybrid, we're including CTCs in our plans and aligning them with as much possible to the plans of our secondary schools that are in hybrid, that are going to be in hybrid return. We're also going to plan on ensuring that we have those safety protocols. I think everything that Mark had shared, and ensuring that we have all the safety measures, even such as our COVID testing initiative, in place to ensure that when we do that, we can have them return as safe as possible.
I believe that's all the time we have for questions tonight. Scott?
Tengo una pregunta más.
Oh, thank you.
Claro
Mía.
que sí.
La última pregunta, Jackie, de
I
Mía.
have one more question, the last one from Mia. Mia says that her son, who's autistic, doesn't wear the masks the right way. And at times he doesn't want to keep washing his hands constantly. You know, how would this personnel would cover the safety?
Education is key. So we have to be working with all of our students, our parents, our communities to ensure the value and understanding on how to wear that mask properly, how to wash your hands properly. But more than anything, in recognizing that we have students who have unique needs and individual needs, and therefore they have IEPs, and being able to, in each situation, as a case-by-case basis, be able to address the needs of the student and how we can best support them, yet keep them safe, as well as the rest of the school and the other students safe, if they're participating in our program in person.
Now that's the end of our questions. And I believe we have another survey. Is that right, Board Member Schmerelson?
You are correcto, Jackie Goldberg. So let me tell you that before we close our meeting today, we would like to run a quick poll to find out how you are feeling after you learn more about preparing for this event. Going back to school or distance learning or whatever is going to happen. Your opinion is important to us. So we're going to go through these questions with you. So question number one, when the option becomes available, how comfortable are you with your child participating in the hybrid model? Cuando la opción de aprendizaje híbrido esté disponible, ¿qué tan cómodo se sentirá usted y su hijo a participar? Yeah. Number two, what grade is your child or your children in? Check all that apply. Number two, what grade is your child or children in? Check all that apply. So we should move up to number two, right, on the screen? Okay. Number three. Ready for questions? Do you have an English learner, an EL student? You have an English learner or an EL student? You're going to say yes or no. And number four. Do you have a child with an IEP, an individualized education program? Do you have a child with an IEP? You're going to answer yes or no. Okay, and at this time, Board Member Goldberg will give final remarks.
Well, first of all, I know I want to thank all of you for sticking around for an hour and a half of a lot of information. And I want to thank all our presenters and panelists. You have given the community, the Board District 3 and 5, an opportunity to think about where we are going and how we're going to get there. The three things I would say to you that are important to know. One is we have to be for 3 weeks at a lot lower level of new cases in the county before we can even be allowed to open. So that means that if it happens right now, let's say tomorrow, they said that you can start those 3 weeks. We're talking about somewhere near Thanksgiving If you go to Thanksgiving vacation, that's a week everybody's gone. When they come back, we're in for the high schools, we're into finals, and for everyone else for the concluding activities of a semester. In my opinion, this would not be a good time to reopen schools, even if we were able to. Much better, to my point of view, would be to wait until the new semester in January. The second point I would make to you is that nothing you heard tonight is final. And the reason is because we still do not know how many families would like to have a hybrid plan and would put their children in it, and how many families want to stay completely online. And the third thing I would say to you is, if you have not already voted, go out and vote. Don't mail it in, go vote. There are places to do that. We have 2 propositions and measures that affect your schools. One is Proposition 15, which is about money for the schools and communities from those folks who have, shall we say, very big commercial properties and aren't paying their fair share. You have to decide how you're going to vote on it. I'm not here to tell you that. But the other one to look for is Measure RR, which has to do with a bond issue that would allow the school district, without raising anyone's taxes higher than they currently are, their property taxes, would allow us to continue modernizing our schools. Mostly, I want to say to all of you, we know how hard it is for you and your children. We know that this is not what anyone wanted. But I do believe that those people that you've heard from tonight, and the many, 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 many others on each of their teams, are doing everything possible to help your children get as much educational opportunity as they can, in spite of the terrible circumstances we all find ourselves in. And so I want to thank them, and I want to thank you, and I want to thank my colleague Scott Schmerelson for the idea of having us do this together. I appreciate it. It means that this staff that gave this information tonight doesn't have to do it each one separately. And I think it was a terrific idea, and thank you for inviting me to join you.
And thank you, Jackie, for allowing me to be with you on this wonderful webinar. My goodness, I hope we can do it again. Okay, so let me thank again our speakers, and man, oh man, thank you interpreters, Spanish interpreters, American Sign Language interpreters. My goodness, you were just fantastic. So thank you, audience, for participating. I think we were able to answer many questions, but if you still have questions about the certain topics, please contact the appropriate divisions, and we have provided the information in the chat throughout the Zoom. So for those of you who are not able to join us, and even for those who did join us and want to hear it again, you'll be able to find a recording of this presentation on my Facebook page, and you'll be able to find the presentation in Spanish on my Spanish page, Schmerelson en Español. Just so you know, you can play these over and over again, speed them up, slow them down, listen to those questions, and read the slides very slowly and very carefully. Any questions about the event, please call my office, 213-241-8333. 213-241-8333. Thank you so much, everyone. Everyone, thank you, and enjoy your evening. Thank you so much.
The recording will also be on my Facebook as well.
Excellent. Excellent. Thank you. Excellent.